As we stated in the previous video, our goal is that, in a nutshell, we do not want the patient to die, and how do we make sure that that doesn't happen? So I'm going to go over the list of tools that are at our disposal to prevent that from happening. All right, so the tools we're going to use will be, here are our tools. The first one's going to be the EKG. Second one is going to be troponin, third one is going to be imaging, and the last one is going to be the cath lab. So 1, 2, 3, 4, and they go down like this. You start with the EKG, you go to troponins, imaging, and then the cath lab. Now this may sort of make sense, but this is exactly the wrong way to think of this. And at least in my opinion, I will point out the way to think about this and structure this, that it makes a lot more sense when you're trying to understand the overall concepts. So get rid of the structure in your head, and let's sort of think this through, because we want a structure that actually sort of makes sense in regards to the clinical pathway these patients should take. So I would argue that put your tools over here. You start off with an EKG, you go to set up troponins, and then you have imaging. Right, so 1, there we go, 1, 2, 3. And what you actually do is you put your cath lab over here. So if any point in time, this, or this shows any evidence of any acute danger, the patient is going to go to the cath lab, and the cath lab. This cath lab is the place to send them if you're at all worried about the patient. If any of these things over here suggest that the heart is about to be hurt, injured, or part of it's dying, or if it's at risk for dying. So I really can't stress this enough. If the EKG shows that there's a STEMI and you're knocking off a wall of the heart, the patient goes to the cath lab. If the EKG is okay and their troponins are elevated, the patient goes to the cath lab. If imaging shows that if the troponins are negative and the imaging shows that the patient's heart is at risk, the patient goes to the cath lab. It's just a question of when will the patient go to the cath lab. So in order to drive this point home, the cath lab, you should associate with two things in your mind. Because the cath lab is a place to go to escape danger. The first place you should associate it with it is sanctuary at Notre Dame. So in medieval times, and particularly sacred areas, people that were in danger could claim sanctuary from the church, and this cath lab is the patient's sanctuary. Of equal grandeur because of the beauty of the Aina. So the cath lab is the patient's pu'uhonua, which is the city of refuge, a place of safety on the big island of Hawaii. So I think I've driven this point home, but you can't really drive this point home enough. Working up the patient, EKG shows danger, safety of the cath lab. Working the patient up, troponin show danger, safety of the cath lab. Imaging shows danger, safety of the cath lab. In the next video, we'll discuss in detail how all of these points actually you can recognize the danger, and once you do recognize the danger, you can send the patient to the cath lab.